I felt like the motivational interview went okay. I think there were some parts that felt pretty natural. Um, Empathizing with the patient, I think that's something that we do often in healthcare, regardless of what area we're working in. I think I did a good job of eliciting change talk and um, evoking what behaviors the patient wanted to change, and without the BMJ article refers to it as the writing reflex, where you identify the problem and kind of spit out what you think they should do. So I did try to avoid that. I also thought I did a good job of using the patient's name and some of the active listening techniques, as well as honing in on a specific health promotion behavior. And then even within that realm of the diet, saying, is there something specific about your diet that you want to focus on for now, and kind of make a specific goal that's going to be more realistic and actionable. Things I definitely could have benefited from was using less, and I think it was clear that it just didn't feel supernatural. I think it's a great way to communicate with patients, but I don't think that it's something that we're very used to in acute care and critical care, unfortunately. I try to focus on the model, based on the rubric, kind of engage, focus, evoke, and plan, and focusing on, one or two specific changes. In this case, it was making one healthy meal per week more, and then potentially going up from that. Asking, what do you think the change would do if you were able to eat a more balanced diet? Like, how would that affect you? Do you think that would make you feel better? What do you think? How have you been feeling about your diet and energy levels lately? Trying to be really curious with the approach and not accusational. I think those two videos that were posted in the module 1 with the example of the woman trying to quit smoking was very helpful for the kind of obvious do's and don'ts. But I think that actually integrating that was trickier than I thought. The top 10 useful questions that the BMJ article references, there were 2 of those that I wish I would have utilized. One was, how important is it for you to change? And where does this leave you now? I think would have been a great way to wrap up.